there. What's your name? Okay, I've got you. Make yourself comfortable there. I'll be with you in just a second. Okay, I'll just have a little look through some notes here. Alright, we've not seen you for a while, so what brings you here today? Okay, so you're a little concerned about your skin, that's fine, I can look at that for you. And a general checkup. Yep, okay. Well, my name is Nurse Sarah. Pleased to meet you. Okay. So what is it that's concerning you about your skin? Okay. Your acne, alright. And is that just on your face? Okay, just on your face. And how long have you had that? Okay, a few years, but it's got worse recently. All right. Are you on any different medications? No. In fact, you're not on any medications, are you? Have a look at it. No, that's good. Nice and healthy. All right. Okay. Is there anything you can think of that may have made your acne worse recently? Okay, so you've just been under a little bit of stress, okay? Do you go swimming at all, anything like that? No? No activities where you've been getting hot? Sports? No? Okay. How's your diet? Pretty good, okay. Do you drink alcohol at all? Okay. How many units a week would you say? Okay, that's very low. Do you smoke? No. And I do have to ask you, do you take any recreational drugs at all? No. Okay. All right. Are you feeling otherwise well? Okay. Well, I can certainly take a look at that skin for you. All right, and do a little bit of a health check. All right, that's okay. Okay. So let me just get my gloves on. That's super. So before we start, I'd like to take your temperature if that's okay. Alright. Just going to pop this just in your ear, not too far in, okay. It works on infrared. Okay, just need to put a new speculum cover on. There we go. Okay. I'm just going to pop it into your left ear if that's alright. Okay. There we go. And you'll just hear some beeps. That's fine. The temperature is 36.8, which is perfectly normal. Okay, I'll just write that down. Okay. And I'd just like to have a little listen to your chest, okay? This won't hurt at all. I'll try and warm the stethoscope up a little bit so it's not too cold for you. Nobody likes a cold stethoscope. Okay. Right, so I'm just going to move your top a little bit there. Right. Placing the stethoscope onto your chest. Just breathe normally for me for a second. Okay. Now can you take some deep breaths in and out for me? So in and out. Okay. And again in and out. Alright. Again. Okay. And again. Okay, now breathe normally for me. I'm just going to pop the stethoscope just onto your neck there. Okay, and could you just do a little cough for me? Okay, that all sounds fine. Right. Now I'd like to take your blood pressure, if that's okay. So I'll be just popping this cuff onto your arm, inflating the cuff, and I'll have the stethoscope just in the crease of your elbow to listen to the brachial artery. Okay? It will feel a little bit tight. I'm sure you've had it done before. Okay, but it won't last too long. Alright. Okay. So could you just outstretch your left arm for me? That's perfect. Okay, let's just get that round there. There we go. That's lovely. Just got to make sure my valve is open there. Okay. And I'll just pop the stethoscope onto your arm. Alright, here we go. They are sticky, aren't they? Let me just try it on the right side. I like to do both sides for comparison. Okay, outstretch that arm, thank you. Let's just pop that on there. There we go. Alrighty. Make sure that stethoscope's in the right place. There we go. And I'm going to inflate again. That's fine. Very healthy there. Let's make a note of that. Your blood pressure is 122/80. Pretty textbook. Okay. So have you had any problems with your eyes or anything recently? Alright, okay. Well, I'm just going to take a little look, okay? For this, I'd just like you to look straight at my nose. Alright. I'm just going to shine this light in. very briefly. Okay. Alright. Just look up for me. Okay, look down. Okay, look up. Look down. Just look up again for me. That's fine. Now, would you just like to follow the light very quickly for me? Okay, so just follow, keep your head nice and still, and follow up and down and across. Okay, and across, and up and down, and from diagonal down and up diagonal and down. That's wonderful. Okay. Now, I'm going to have a little look inside your mouth, just to check everything's good there. You've not had any soreness in your mouth or anything like that? No. Okay. That's good. Okay then. Open nice and wide for me. Thank you. I'm just going to pop that in there. Okay, and say R for me. Okay, just having a nice little look around in there. Okay. Could you just put your tongue to the roof of your mouth? Thank you. Okay, just press down again there. Say R one more time. Okay, that's fine. I'd just like to have a little feel of your lymph nodes. Okay, so just down the neck. Okay, just behind the ears. Okay, under your chin. And just across your shoulders. That's all good. Nothing felt uncomfortable there. Okay, and I just want to put my fingers on the side of your jaw, and I'd just like you to open and close for me just to check your temporomandibular joint, and again tell me if anything is sore. Okay, alrighty, there we go, and open wide and close, and again. All good, thank you. Well, you're checking out fine so far. So before I move onto your skin, I'll just like to have a little look around your ears. All right? Okay. Right then. So I'm going to be using the otoscope here, and I'll just gently pull up and back on the ear, insert this speculum into the ear canal, and have a little look around. If anything is uncomfortable, do tell me. Okay, but I'll be really gentle. You've had no problems with your ears at all, have you? Good, good. Okay. So let's start with this side. Alright. Okay then, nice and still for me. I'm just going to pop the speculum into the ear. There we go. And just have a look around the ear canal. It looks fine. There's no redness, no build-up of wax. Normal amount there. and I can visualise your tympanic membrane, your eardrum, and that's clear. There's no bulging, no wrinkling, no fluid build-up, and I can see all the structures behind it. That's perfect. Just withdrawing now. Okay, there we go. Well, that side looked amazing, so let's just have a look at this one. Okay, keep nice and still again for me, and I'm just going to pull up and back on the ear a little bit. There we go, and insert the otoscope. Okay, and the ear canal looks really, really good. No redness, no swelling, no lesions at all, and no build-up of earwax. Again, your eardrum is perfectly healthy. Can see the structures behind. There's no bulging, no wrinkling, no fluid. That is a very glamorous ear canal. That's very, very good. Okay, just withdrawing that now. Okay, all good. So, I'm really happy with everything there. Let me just jot a couple of little notes down. Right. So let me have a little look at your skin. I'm going to gently cleanse it first, okay, with a very lovely, soft, refreshing wipe. Smell gorgeous. Alright then, so let's just have a little wipe around. Okay. Just to clean off any little bits of dirt and debris that you may have picked up en route here today. And this helps remove any excess oils as well. And we'll have a nice look at that skin. Are you doing all right there? Good, good. Okay, let's just give that a little waft. Okay, so let me just have a close look at this, alright? Okay, I can see you've got quite a lot of blackheads, but you've got some rather large red inflamed bumps. Now they look to me like cystic acne. Got quite a few around the jaw, and then some just on your cheek. A couple of little spots on your nose, but they're nothing to worry about. But these look really, really quite tender. Are they tender? Yeah, okay. Okay. Just gently pressing around. Let's have a look over here. They do look like cystic lesions. Do you find that your skin gets very oily? Okay. Let's just check your arms there. I didn't notice anything before, just for any other rashes or things like that. No, that seemed fine. No, all seems fine there. Could you just pop your head that way just a little bit and I'll just check around there. Okay, and just pop your head that way a little bit. Okay, okay. Alright. Let me just take a closer look at these. A little bit sore there. There's some that are very blind. They've not come up into a head, but you've got some there that are pustules with a head. Please don't pick them because that causes the bacteria to spread. Have you tried anything for your acne before? Okay, just some stuff from the pharmacy. Okay, what was it? Do you remember? An over-the-counter benzoyl peroxide. Right, okay. Well, that can help, but it also dries the skin a hell of a lot as well. It can damage the skin. Because this looks like it's spreading out and looks quite angry, I'll just say to you for now, just keep your skin nice and clean, and I'm going to refer you to our lovely dermatologist, Dr. Ali. And Dr. Ali is amazing, and she will take a real close look at your skin, and she will prescribe something for you which will really help it, okay? Because I think this needs a specialist to look at it. Alright, I don't want to be giving you antibiotics and things like that without her seeing you first. Alright, she is so good, and she will really check that out. Okay, and it's her specialist field, so you're in really good hands with Dr. Ali. Yeah. All right. Well, I'll just make a note of that. Okay. She is actually in the practice today, so when you leave here, go to reception and see if she's got any appointments available today. It might be that you might be able to see her this afternoon, save you leaving and coming back. I'm not sure on her schedule. Yeah, okay. Alright. So do you have a nice cleanser for your skin? Okay. And do you have some nice brushing wipes as well? Good, that's good. The wipes are nice as well. Alright. Do you actually pick your acne? You can be honest. I think most people do. Yeah, just a little bit. I know it's irritating when you just want to get the content out of it and make it feel a little bit better. But that does spread that infection and can actually make it go a little bit deeper. Alright? And that can cause the redness and bruising as well, and scarring. Okay. Let me just mark out the areas of major concern. And I'll drop this through to Dr. Ali. She can just take a little look at it. Okay, so let's just I just sketch place there. Right. so the majority around the jawline. Okay, just around this area here. There's a couple just on the cheek area, okay, and on your forehead, a couple there of the larger ones, okay, a couple of little ones on your nose, okay, I'll just put query, cystic acne, but she will know best, alright. That's what it looks like to me, but that's why I want her opinion, because she's the specialist. Okay. Well, I'm sure she'll get you on the road to recovery with that soon. Okay, but all your other health checks are absolutely perfect, so I've got no problems there. Alright, so I'll drop this through to Dr. Ali, and if you just see when the appointments are free, you might be able to get in to see her this afternoon, as I said. Okay, well, it's been a pleasure to see you today, and if you have any more problems, do come back, but in the meantime, I'll hand you over to the lovely Dr. Ali. Alright, so take care now. Bye-bye.
Hi, I'm Dr. Ali. Yes, Nurse Sarah did explain that you'd be popping by today. Yes. Okay, so I specialise in dermatology, and Nurse Sarah did mention that about your skin. It does look very painful. Yeah, I've just been looking at your notes actually. She did send through just your general health. Everything seems to be okay, which is good. But yeah, she said the problem areas seem to be your jaw and your cheeks. Yeah, your cheeks look really uncomfortable actually. There's a little bit around as well, but they're inflamed, aren't they? Goodness me. Okay, right. So I think what I would like to do for you today is a bit of a cleanse, just sort of go over, clean your skin so that I can really take a good look and just see what the best route forward for you is. But I mean, there's a lot of scarring going on here, so I'm thinking this has been going on for quite some time, hasn't it? That's not nice to suffer with on your own. Have you tried any sort of things at home, any topical things, or have you just sort of generally left it? I'm just going to scribble whilst you talk, if that's okay. Yeah, that's not the best. That's something that's an internet thing, that, isn't it? Social media. Yeah, don't believe everything you read online. I really wouldn't have. Yeah. And what's your general sort of skincare routine? Do you have a routine, or do you just kind of, do the same? Some people have things that they've done for a long, long time, and they've just never changed it up, or you just don't know. Okay. Okay, well that's good. Okay. Right, okay. That's good, really good to know. Exfoliation. Exfoliation is fantastic and very, very important for your skin. However, if you're suffering from what looks like cystic acne, that's a big no. Big, big no. And yes, it's so, yeah, it's difficult. It's really good for your skin because that's what allows your skin to absorb really nourishing products and moisturizing products. When you have cystic cystic acne, all you're doing is breaking open those wounds essentially and just spreading that bacteria around your face. And because you're exfoliating all over, you're opening up bits all over your face, and that bacteria can get in everywhere, and that's what is primarily going to be spreading your acne. Okay, so from this day forward, no more exfoliating. Okay, chemical peels are okay, but you do want to be careful because you don't want to aggravate the skin. So even though it's not a manual exfoliation and you're not breaking that skin open, you might find that you have a bit of a reaction. That's one I would say start with chemical peels if you're going to get back into exfoliating, but I wouldn't suggest do it yet. Not yet. We need this to heal because that's really quite sore. I'm trying to not touch it, but I do need to sort of pull the skin a bit just to. The chemical peels will be good for the scarring, so that's why I think just give it some time. We just need to take this a stage at a time and just, you know, see where we end up. Okay, I'm just going to say that. Chemical. Okay, what sort of moisturising products do you use? Okay. It doesn't have to be branded. This is the thing. Just normal drugstore products are absolutely fine. You know, there is evidence with some more expensive products that do suggest that they can offer different outcomes. That's down to personal preference completely. I use a mixture of more expensive things and cheaper things. I've found what I feel works for my skin. Always working for my skin because I don't have perfect skin. It's problematic, and different seasons create different problems. So I have to mix it up and try different things. So there's lots of things we need to take into consideration here. So don't feel like you've done anything wrong. You know, it's a learning thing, and figuring out your body. Maybe there's something else that's at the cause of this. You know, it could be hormones, it could be dietary, and it could also be down to what products you're using. If your moisturiser has a particularly high oil base, that's really good for moisturising, but maybe it's not the right type of oil for your skin. If it's a natural oil, it should be fine. If it's an artificial sort of manufactured thing, which you can find can be the case with cheaper products. So we'll have a look and we'll see. Alright? Okay. So where are we? Okay. So it said on your notes that you're not on any medication or anything. Okay, just a few supplements. That's fine. Okay, so you don't have anything on your skin at the moment. Oh, she worked over it. Okay, that's great. Well, I'm going to do a cleanse anyway. I have got this. It's a tri-enzyme resurfacing facial wash. So this is an enzymatic cleanser. So that helps eat away the dirt. But it's a foaming one. So what I shall do, I'm not going to use it to do a big facial wash. I'm just going to use it as just sort of massage it into the skin, and then I'm going to remove it with a damp cloth. Okay. But okay. It's an interesting smell, isn't it? It's quite, it smells clean, almost clinical, doesn't it? But that's because it's got 3 different types of enzyme in it. So it really tackles, it's just deep cleaning. You know, this is something that you can buy. I can prescribe it to you, but it's actually cheaper to buy off prescription, this particular product. So, but you want to be using something like this every day. I'd say at night time, ideally, really get rid of the dirt from the day, and in the morning, a softer cleanser, maybe like a milk cleanser. That would be good for you, because then it's gentle on the skin. It's not too harsh, but it's going to lift any dirt that's collected up overnight and any oils and things like that. So. Okay, just really being really gentle on those cheeks. I'm sorry if it's uncomfortable. Yeah, okay. Right, that I'm just going to leave it there. I don't want to make it any more uncomfortable for you. Okay, I'm just going to rest this over your face. Okay, so it's a nice warm, damp cloth. I'm going to hold it over your face just to help lift everything, okay? It's not too hot, is it? That's good. Okay, just for a few seconds. Alright. I'm just going to hold your chin. I'm just going to gently wipe away the residue. Okay. Okay, let's swap hands. And same on the other side. Pray just to close your eyes. Yeah, that's good. Okay, so you say you don't use anything like that. Okay, just a facial wash. It's very, very beneficial. Facial wipes. There's lots of debates over whether facial wipes are good for your skin or not. Personally, in my opinion, I avoid them. But they are very good for, let's say, emergency situations. But I mean as in, if you're travelling and you, I don't know, you need to clean your face, they're good for it. Or situations like Nurse Sarah this morning, yeah, that's okay, but you don't want to be using them as an everyday, because they don't clean the skin, and actually all they do is spread everything around. So I mean, they're good as a once off every now and again, but if that's your daily cleanser, that's not good for your skin. That's not effective enough. So that's my advice. Okay, right. I'm just going to tone your skin now. A toner is very important. Some people just don't want to use them, but you want one that's alcohol free, no alcohol whatsoever, because alcohol is just going to dry the skin out. Even though it does kill off bacteria and clean it a bit more, but this one, for example, is a balancing lavender toner. Lavender will be so good for your skin. Because it's so gentle, it's calming and soothing. It's going to really help balance, as it says in the name, balancing. It's going to help balance your skin out and just calm it down, basically. It's particularly good to use at night because the lavender really helps you to relax as well. The sweet aroma of lavender is a very natural, just calming. It's just the prime time to use is before bed. A lot of pillow sprays and things use lavender in them, so okay, so I'm just going to cover your eyes up, okay? You don't want it going in your eyes. I'm just going to just take some deep breaths as well, okay? does that feel? It's nice, isn't it? It's just so cooling and delicate just when they drop on your skin. Okay, right. Just let that dry. Yeah, okay, that's fine. Now I would like to do a mask, okay? I don't know if masks are something that you do very often. Okay, right, another thing to add into your routine. Masks are brilliant, okay? I think for you, I suppose things like, you could do clay masks, but make sure they're gentle. We don't want clay masks. Something that you can get, sort of repair masks that are clay, or like blemish repair masks. You don't want anything that's going to dry and go hard on your skin. But this one in particular, this is a dynamic resurfacing gel mask. So this is a skin smoothing mask. So it helps to refine and smooth the skin surface. Skin feels smoother, shine-free and more radiant. This can have a bit of a tingling effect on the skin. This isn't one I'd recommend doing at home too frequently for you at the moment. I'd like to do it on you today, just because this is a skin cleansing range, okay? So this is just going to really make sure that we've got rid of all the dirt and everything. I'm quite confident we have, but this is a good step in that range, okay? So I'll just pop some on there. I'm just going to smooth it on. This is one you can apply with your fingers. It's really important that your hands are always clean when you're touching your skin. Okay. So this is just smooth it on. It's cold, isn't it? I know. It gives a very cold sensation, and like I said, slightly tingly as well. So I'm just going to pat it a little bit, okay? Just a little bit of patting, just to make sure that it really activates on your skin. Brings the blood in your skin to the surface a little bit, just to help engage it a bit more. Alright, okay. I'm going to just pop the cap on that. Okie doke. Right, I'm just going to leave that for about 8 minutes. Alright. Just make sure it's not too... If it's uncomfortable, please say. It should be okay. Alright, okay. Okay, how's that feeling? Okay, right, I'm going to remove it. I've just refreshed, I've got a fresh damp cloth. I'm just going to, if you want to close your eyes for me, okay? This is one you do not want to get in your eyes, because it's, that would be very uncomfortable. Okay. Alright, same as before, I'm just going to hold your head and just make sure we get rid of it all. Just down your nose as well. Alright, I'm just going to swap hands. Come around this side as well. Okay. Lovely. I feel okay. Okay. The cold sensation does wear off. It can feel strange for a little while, but I'm going to tone, okay? Again, because it's really important that you tone whenever you've had any heat or sort of intense moisture on the skin. You want to tone after, because that just closes your pores off. Okay. Right, so same as before, I'm going to cover your eyes up again, okay? Okay, we're getting low. Alright, just another deep breath. I'd now like to do some extractions, if that's alright. I'm noticing quite a few blackheads around your nose. Things like blackheads are okay to remove, so long as you do them with clean tools, clean hands, and clean skin, most importantly. Things like the pustules and things, we really want to avoid picking those. I know it's tempting, and I know it's satisfying sometimes, but when they're really angry and sore like that, you need to leave them alone. By all means, apply an antiseptic cream. I'm going to give you something as an anti-inflammatory today, but if they're really sore, you just leave them alone, because you're risking infection, and you're going to push that infection deep into the skin and breaking blood vessels and things like that, and then that's when you get broken capillaries and scarring. Okay, and scarring's really hard to get rid of, so I just, for your sake. Okay, so to get rid of blackheads effectively, you want to have a couple of tissues. Alright, and we're going to wrap them around. We're going to push it in half and wrap it around your finger. These are quite big tissues. Around your finger. And then okay, so you're left with 2 points. These are thicker than I normally like, so I'm going to have to speak to admin about that, because not so easy to work with. But this way, they're clean. You've got something that's going to absorb the excretion, and we can have more. You've got more traction. There's less risk of scarring, because nails, digging your nails in, that's breaking the surface of the skin, and you're just going to damage. All right. Okay. So if it's uncomfortable at all, please, please, please let me know. We're just going to apply. I'm going to hold your head with my other fingers. All right. And then I'm just going to apply pressure. Oh, there we go. Okay. Okay. Have you done this before? Like any blackheads and things? Okay. It's a difficult one. You don't want to pick them too much, because if you enlarge the pore, it doesn't shrink again. So, but you also need to get rid of it, which is where exfoliation is good. But I'll just give you a helping hand with this. Okay. Just have to turn the tissues a bit once you've got a little bit. Okay. Lovely. Oh, that was a big one. Okay. Okay. Right. Don't want to make your nose too sore. Okay. Right, I'm just going to have a look. I think we've got rid of the big ones. I'm just going to look on your forehead, because sometimes blackheads can build up around here. I know you've got a couple of little spots on your forehead. Obviously not going to pop those. But you're... Okay, there's one there. Oh, okay, that's got that. That's good. So yeah, your cheeks is mostly pustules, isn't it? Okay, I can see a couple on your chin. Ooh, okay, we got that one. Okay, there we go. Alright, I'm not going to do any more. Chin, your chin is your, like, most hormonal point on your face. So just get rid of those. So you don't want to pick it because that's where you're going to increase bacteria and everything, but yeah, I mean, yours isn't actually too bad. For you, it's the cheeks. Things like wearing masks do not help. All I would really recommend with that is if you're having to wear a mask regularly, don't wear makeup around the mask area, because what happens is heat builds up under your mask from your breath and opens your pores up. The makeup that is sitting on your skin then goes into those pores, okay, and gets trapped. Alright, so that's when you're going to get really big flare-ups, so avoid makeup under any mask. Alright, if you're wearing it long, it's different, I suppose. If you're popping into a shop quickly, it's still not ideal, but if you're popping into a shop, it's a 5-minute job, that's, you know. If you're going to be wearing a mask all day, on and off, just don't. Just leave it free, alright? Just want what's best for you, okay? Alright, I'm just going to put some toner on these cotton pads, and instead of spraying your face this time, just to make sure we've got rid of all the little bits, alright? I'm just going to wipe over your whole face. I'm going to do a bit of a blotting action, especially around the problematic areas like your cheeks. This way the toner is absorbed, but it's not spreading anything. You're not risking breaking any surface, creating any lesions or anything. Alright? It's nice and cool, isn't it? I know, it's so soothing. And it just looks so painful. I really do feel for you. Okay. Right. The next product I have for you is a tea tree product. Okay. So this is an anti-imperfection daily solution. This is something that I actually use personally, and it comes in a little pipette. Okay. And it's just tea tree. Okay. Tea tree is, you know, some people are really sceptical over sort of herbal remedies, things like that, and sort of natural products, but natural products are so effective. Tea tree is renowned for tackling infections, reducing inflammation, and cleaning, most importantly cleaning, okay? I was really concerned that this would be quite drying on the skin. It's not at all. It really is not at all. So this, you can see it's quite liquidy. I find it absorbs really quickly. So I would just do 1, 2, 3, 4, and a little bit on the nose, okay? And sort of a patting action, a bit of a rolling pat on the skin. I don't want to be spreading it around, okay? Rolling pat. You can either drop it onto the skin or you can drop it into the fingers and then do it that way. It's completely up to you what works best, alright? I'm gonna tell you what, I'll do it with the fingers this time, alright? I'm just going to pat and roll. Alright, it smells really strong, yeah, but it's not, it doesn't sting, nothing, no, but that will really, should help to tackle your redness and the aggression of these spots, alright? I'm going to give you this one, alright? Because that is I think this could really help you, even though it's a natural ingredient and not a chemical or a prescribed product. This is something you can buy over the counter. Okay, right. So that's your serum done. Do you see it dries? Just sucks straight in. And I was really worried at first because I thought, oh, does that mean I've got dry skin, or is it dried my skin out? Because it's not even an oil, it is a serum. But because of the type of product, it just means your skin has absorbed it straight away. Okay, so that's absorbed nicely. Okay, next thing I'd like to do is just moisturise for you. Okay, seeing as the time that it is, I'm going to use a night cream on you. If it was a morning appointment, I would have used a day cream, but as it's later in the day, a night cream is perfectly fine. It's really important now that you don't go out in the sun, okay? Using that cleanser and that mask. If you do, you need to put an SPF on, but the thing is, SPFs have oils in them. You don't want to be putting sun cream on your face. That's just going to anger things further. So for today, not to tell you what to do, but I would recommend that you go home and just relax. Stay inside, make a cup of tea and put your feet up, okay? So I'm going to put this night cream on you, okay? So this night cream has barley, quinoa, sweet almond milk, and ylang ylang and lavender as well. So that's why it's really good for a night cream, because it's going to sort of calm your skin and calm you for sleep, okay? This particular product is particularly good because it's made from superfoods, so it's really nourishing for your skin. Things like that are just really good at it's literally feeding your skin the goodness that it needs. I would like to talk to you actually a little bit about your diet, if that's okay, and your sort of work-life balance. Yeah. Okay. Just going to let that, and I haven't rubbed it in completely because I want you to I put a bit more on than you normally need, but I just really want to make sure that it's got the moisture, the excess moisture, so that it can take it in. Alright, and I'll rub it in a little bit more after this. Okay? Right. So we know that you're not on any medication, which is fantastic. Okay, but what sort of, like I said about work-life balance, what sort of stress levels do you have on a daily basis? Everybody suffers from stress. It's nothing to be ashamed of, nothing to be embarrassed about. Stress is just a daily thing, okay? And some people find it more severe than others. Some people don't let it affect them, and that's amazing. Are you a particularly anxious person? Because anxiety leads on to stress, and it's just, yeah. Right, okay. Okay, yeah. Oh, God, that's tough, yeah. Right. Do you get much sleep? No. Okay. I think you need to maybe look into some breathing exercises and maybe meditation or something before you go to sleep, just to try and calm your brain, calm your mind and body, and be able to sleep a bit better, okay? And get better quality sleep. Sleep is when your skin is going to heal, okay? And I'm concerned about these lesions and things. So if you're not cleansing your skin appropriately before you go to bed, and then you're not sleeping very well, it's just a recipe for disaster, really. So hopefully this is a step in the right direction, okay? So, you know, taking care of your skin in turn makes you feel like you're taking care of yourself better. Even if you weren't aware necessarily that was a problem, your well-being is going to improve, okay? Okay, so that's that. Your diet, okay, that's really important. What sort of diet do you have? And please be honest, I'm going to be the first one to admit I don't have the best diet. it can always be improved, but I do really make sure I try and include some vitamins and minerals in a day, vegetables, skin problems such as this. Green vegetables are so important, so important. Broccoli, kale, peas, beans, like anything green, basically. Spinach is very good. They're also very high in iron, and many other nutrients that you need. And they also enable your other nutrients that you take in during the day. They enable those to your body to absorb them better. Okay. So I would really recommend really getting those green vegetables into your diet. But I would maybe try and improve your diet a little bit. I'm not suggesting that you eat badly. I just think if you're really serious about tackling this, we need to attack every possible issue. So I think diet is a good one. Stress 100% needs to be attended to. Okay. Whether that's seeking some help, speaking to somebody, just finding ways. You just need to, it's not good for you to be stressed, alright? Not just for the purposes of your skin, but in general, for you, that's not nice, alright? Okay. I don't think I've really got any more questions for you. I think now it's just a case of time. I've sort of shown you different ways to look after your skin. Hopefully they can be effective. I'm going to write you a prescription for some doxycycline. So this medication is you take 1 tablet every day, and it's about 3 months. So I mean, I don't like to prescribe medications like this, because I think the issue is better off fixed through lifestyle changes. And if that doesn't work, then we know that there's something else going on. But because this is so severe and clearly so painful and problematic for you, we need to kill off this bacteria that's obviously taking over at the moment. And doxycycline will do that for you. The issue is that when you come off of them, it is likely to just come flooding back. Alright, so we're aware of that. But we can use that. I want to try it in the meantime, but whilst you're on those, please address the things we've talked about: skincare, diet, and stress. Alright? And hopefully, maybe when you come off of these tablets, it won't be such a harsh impact. What I would also like is for you to come back in about 4 to 6 weeks. If you come back in about, ideally 6, book an appointment for 6 weeks. If in a month's time, so 4 weeks, you're feeling like nothing's changing and you're not happy, then come back for 4 weeks. I don't want to see you any sooner than 4 weeks, because we need to give the tablets time to work. And a month should do that. Okay, any sooner than a month is not giving it enough time to actually effectively work, because it could be a good month before you actually see any change. Alright, so let's just see. So Dr. Ali and I'm prescribing doxycycline for 1 a day for 3 months. See you in 6 weeks, 4 weeks, if not happy. I think if you're not happy and it's less than 4 weeks, I'd rather you give us a ring. Okay. Right. Oh, you can take the ointment with you, won't you? Okay. I think after that we'll go on for something a bit more topical, but I'm just going to sign. If you could sign as well, please, just to make sure you're happy with everything. Ah, great. Lovely. Okay. So I keep a copy and you keep a copy. Okay, so here is your prescription and your ointment. Alright, so you take those. Alright, great. Okay, well, it's been lovely to see you, and I really, really, really hope that we can get this sorted for you, okay? Get some of that confidence back in you. Alright, take care.